at IVA are on a mission of nurturing 28 days of ovarian cycle. I would like to say a big thanks to Dr. Vaishali Sharma for giving us this opportunity of hosting this session today. We have already conducted 500 plus webinars during this pandemic, and all the webinars are available on our IVF Virtual Academy of IVA. So today's topic that we have is IUI still an option in advanced fertility era, and Dr. Vaishali will be speaking on it. So a little brief introduction, although she don't need any, but would like to take this opportunity. So she's an MD Obs in Gynecology from AIIMS Delhi, Diploma in Specialized Advanced Gynecological Endoscopy from prestigious Kiel School of Gynecology Endoscopy in Germany. She is also having a lot of achievements credited to her, secured 27th rank all over India in AIIMS, MD entrance exam, and opted for career in Obs in Gynecology. She has recently won 2 national awards at National Fertility Conclave by Economic Times. She was awarded with National Hall of Fame Laparoscopic Surgeon of the Year 2019 and recognized as Budding IVF Specialist of the Year at national level. She has also received Distinguished Doctor Award from IMA South Delhi branch in recognition of the outstanding professional services towards patients' care. She has received National Women Pride Award 2021 for being the most trusted gynecologist, laparoscopic surgeon and infertility specialist of the year 2021. And with she's carrying 15 years of experience and practicing as laparoscopic surgeon in gynecology field for quite a long time, and a highly successful infertility specialist treating blocked tubes with either performing laparoscopic tuboplasty or offering IVF. She has an illustrated academic career that we can see here. So now, Dr. Vaishali, now I hand over the mics to you. So today we have Anil Kanjika with us, who is the zonal manager and managing the whole Delhi, and we have Amit, as you know him very well. So now the mic is yours.
Yeah, hi. Thank you for such an elaborate introduction.
Stop share. Next.
Welcome, ma'am.
So now you can share your screen, Doctor.
Yeah, I'll do that. Let me start. I would like to discuss about obviously IUI and its current scenario in the current era when we have so many options with us. So today we will be talking about IUI and
a little loud. A little loud.
Oh sure. Can you hear me? Am I audible now? Yeah. So today we will be.
You are audible, but the volume is a little low.
Okay. Just a minute. Hang on. Am I audible now?
Yes, better.
Yeah. So we will be discussing intrauterine insemination and its place in current scenario, current era, where we have all the advanced fertility options with us like IVF, ICSI and so many other. So we all know IUI is quite an old process where we are using inserting the semen inside the woman's womb, and it is quite a non-invasive, or we can say very less invasive procedure as we consider these other options that we have nowadays. Are my slides visible to all of you? Hello?
Yes.
Oh, okay. Yeah. So if we look at the success rate of IUI and its scenario in context to our own country, India, though we know that the success rate of IUI is not that good if we compare it to IVF, just one cycle, and looking at very critically at the clinical pregnancy rates in first cycle of IUI, it is 17.3% as was observed in one study. So it varies with many things. It depends on many things like women's age and the protocol that is used and what all medicines or what is the method has been used for the semen preparation, and there are many things in the IUI cycle which determines the success rate. But if we see at the success rate of IUI, we compare it to one cycle of IVF, it is definitely slightly on the lower side. But why is it important in current scenario? The importance lies in the fact that it is, if we look at the Indian scenario, the IUI and IVF, all these procedures are not included in any health insurance. So if a person who has to undergo any procedure related to infertility, that directly comes to his or her own financial burden. And if we compare the costing of IUI and IVF, there is a marked difference in the costing of one cycle of IUI as compared to the costing of one cycle of IVF. So, looking at our scenario, while in other countries in Western world, IUI, IVF, all those procedures are covered by health insurance or by the government. So for them it is very easy to decide between do they want to go for one cycle of IVF or do they want to go for one cycle of IUI. They look at the success rates and all those things. We are also concerned about success rates, but we also need to say the costing which is included in because of IVF, or the costing which is there due to in one IUI cycle. So if we compare those things, IUI is much cheaper, much less invasive, and it gives you an option of going for availing 2 to 3 cycles of IUI before if you want to proceed for IVF. And if we look at the indications of the IUI, there is some listings of the specific indications in which we can go for IUI. One is unexplained infertility. As I want to tell you everybody, the basic requirement for the procedure of IUI to be done is that the tubes should be patent. In case your tubes are blocked, then you will have to directly go for IVF. That is definitely more beneficial for you. And IUI is not meant for the people in whom tubes are not good or tubes are blocked. So IVF is the only choice for the people in whom tubes are blocked. But if you are looking at other causes of infertility like unexplained infertility, or cervical factor is there, or mild endometriosis, or mild to moderate male factor infertility, in case there is a single woman who wants to get pregnancy, which is legal in our scenario at present situation. There are many women who are self-independent, they are financially independent, and they want to go ahead with a pregnancy, though they don't have a partner, they don't want to go for a marriage. So in all those conditions, IUI is a very good option for them, as it is not that expensive as IVF, and it is also not that invasive as IVF. So for IUI we have nowadays very specific indications which are really good and which are really providing good success rate in that particular scenario. So if we talk about unexplained infertility, though if we are comparing the Western data and we are looking at what is the success rate of the IVF and IUI, definitely in the Western scenario, IVF cycles they are giving better results. Even in our centers also, IVF cycles are giving very good results. Earlier, the success rate of IVF was used to be very low. It used to be 20%, 30%, 40%. But nowadays, when we are doing an IVF cycle with a controlled stimulation and following the frozen embryo transfer protocols, doing NTAC cycles and making a grade A blastocyst. So there are so many things which have actually developed and which have developed over the last so many years that the success rate of IVF cycles nowadays has really increased, really improved a lot. It's not like which was there earlier 10 years back maybe. The success rate was really not that good. But nowadays the success rate in our IVF cycles have improved very nicely, very good. It is really encouraging. Now we can also convince any patient to go directly for IVF in case their tubes are not that good, in case there is a history of genital tuberculosis, or if there is severe endometriosis. So these are the conditions where we didn't have very good options few years back, but now we have really very good protocols, are very well defined nowadays, and embryology has really advanced many fold in last few years. We have very good cryo techniques are there which helps in making good embryos, which helps us in making freezing them, then thawing them, so that these cycles can help really a lot. And there are many indications which are specifically meant for IUI, not for IVF. talk about IUI indications, I have already told unexplained infertility is a very important thing. There are unexplained infertility, I'll tell you, it is a scenario in which the couple, it doesn't have any problem. Both of them, they are having normal reports. There are eggs, the semen report is normal, tubes are normal, the eggs are being formed every month, the eggs are being released every month, follicular monitoring is showing normal egg growth, everything is normal, but even then the couple is not able to conceive. That is called as unexplained infertility. So in this scenario, IUI gives us a very good option because there we do a thing called superovulation. We give injections, we give gonadotropins which help in making more than one eggs in a cycle. Normally, as we all know, there is just one egg which is formed in one cycle, which is available for fertilization. But when we are giving gonadotropins, then when we are giving other FSH, recombinant FSH, we have so many these things which just a minute, I'll put my laptop on. It is time. Anita, चार्जर लैपटॉप का हाँ उसे लगा लो, लाके लगा दो. So हाँ, so when we talk about IUI and IVF, the unexplained infertility is a scenario in which IUI really helps. It really gives us a very good result because in this, when we give injections, then it helps in making more than one number of eggs are being formed. Just a minute. So this is called a superovulation. Superovulation leads us to make good number of eggs, which helps us in making, which increases the probability of pregnancy in that cycle. So unexplained infertility and the cases where there is mild or moderate derangements in the semen parameters. So in such cases also IUI helps in selection and washing of the semen, which helps in finding or making the semen sperms, accumulating those semens or selecting those sperms from those which are actually good. There are many techniques for semen wash, swim up and density gradient. There are many things which helps us in making good quality semen is washed and it is taken, and once it is ready, we put it inside a woman's womb, which helps in definitely increases the probability of pregnancy in that cycle, because that procedure of putting in the semen is timed with the release of the egg. When the eggs are ready, we are giving trigger shots, and which leads to release of the eggs 36 hours approximately after the release of the egg. After the trigger, the egg is released approximately 36 hours. So what do? We give a trigger shot, and once the eggs are released approximately that after that time, we do the IUI procedure. So this way IUI is also very good for the cases of mild to moderate semen derangement male infertility cases. In case the counts are very low, we may say 10 million. If the counts are less than 10 million, then I would suggest it is always better to go for IVF. Or in case the motility is really poor or morphology is not that good, in that cases of maybe severe oligoasthenoteratozoospermia that we call as, in such cases IVF has better results than IUI. So all the mild to moderate cases where the parameters are not that bad, then in such cases IUI is a very good option. Before going for IVF, a full-fledged IVF cycle, a couple may definitely go for IUI in cases with mild to moderate male parameter derangement where it is. Similarly, endometriosis, it is also very common nowadays. Mild endometriosis is a condition where IUI gives us a better result compared to the natural conception. In moderate and severe endometriosis, I would again say definitely.
Yes, this meeting is being recorded. Please share your CV now.
Yeah, just a minute. So we were talking about endometriosis. So endometriosis is again very common nowadays. We can see almost 1 in every 10 women, female is having endometriosis, maybe mild to moderate to severe, whatever grade it is. And endometriosis sometimes it really causes major problem in conceiving. So the patients in whom their endometriosis is mild only, IUI is a very good option. And for the patients who have moderate to severe endometriosis, in those cases IVF is obviously much better, and they should go for IVF much earlier. Because what happens once you are losing your time period of important window where a good number of eggs can be retrieved, if it is wasted, then it really becomes very difficult for us to retrieve good number of eggs. So always, if you have been diagnosed with any of the gynec condition like PCOD or endometriosis, mild or moderate or whatever, don't waste time. Don't just sit on the report and just keep waiting that everything will become okay. You need to make some steps forwards. You need to take definitely, because there are many procedures nowadays which really helps us in conceiving, which can help you in having any procedure like IUI or IVF, whatever you want to go about. But you should definitely consult a doctor. Don't just wait that it will go away, there will not be any problem. It's not like that. If you look at, there is a thing called donor IUI. It is especially meant for those in whom, for the single women who want to go for a pregnancy, there is this option of donor IUI. In this, an anonymous donor is chosen and IUI is done. In such cases, it is really very successful. Obviously, when there is no problem at all, when the women are less than 35 years of age, success rate of such a cycle is really good. And for those women who really want to go for a pregnancy and they want to have family with that, donor intrauterine insemination is really good. It's not that expensive also. It's quite non-invasive. It can be done in a clinical setting, in a very low setting. You don't need a very high lab for that also. But yeah, you need to get it done from a very reputed center, because when you are going for an anonymous donors and donor IUI semen, then we do all the testing beforehand. All the viral markers are done. It is checked that the person from which the semen has been taken, or the person who has donated the semen, that person is not suffering from any disease, or all the viral markers like HIV, hepatitis B, hepatitis C, all the diseases which can be transmitted through semen are first checked and are scrutinized, and everything has been done. Then only we are taking the semen for intrauterine insemination in the cases of donor. So this donor IUI is really a very good option for the patients of azoospermia in whom it has been proven that there is no sperm in the semen. It provides a very good solution instead of going for IVF, or if they cannot afford a very high-end procedure, donor IUI is a very good option for those patients in whom severe semen abnormality is there. Similarly, if we look at the how do we decide when to go for IUI or when to go for IVF? See, if we talk about unstimulated IUI, that is natural cycle IUI, it is meant for only those patients in whom there is a problem called vaginismus. It is an organic problem, we can say. The couple is not able to try normally, so we advise them to go for a natural cycle IUI, and it is really very successful in such couples. But in cases like unexplained infertility or mild endometriosis, where the couple has been trying for a pregnancy but they are not able to conceive, then in such cases we go for a superovulation cycle along with IUI. We call it superovulation because normally in one cycle only one egg is formed, but in the superovulation cycle, or we call it a stimulated cycle, there we try to make good number of eggs, maybe 2 or 3, not more than that, because that will lead to multiple pregnancies later on. So we try to make 1, 2, more than 1, less than 3 maybe. That increases the probability of pregnancy in that cycle. So this way superovulation is really good. But yeah, all these procedures, maybe IUI or IVF, all of them, they have the risk of multiple pregnancies. Till the time it is a twin, there is not a problem at all. But in case it is triplet or more than that, quadruplet, then definitely the pregnancy become a very high risk pregnancy. So we have to be very careful while proceeding for any stimulation or any cycle. If it is the number of eggs formed are more than 4, we definitely don't want to go ahead in such a cycle, because there is a risk of ovarian hyperstimulation also. If we compare IVF, ICSI with IUI, then definitely the success rate is much higher in IVF and ICSI cycles. For the couples in whom it is clear-cut indicated that AMH is low, or tubes are blocked, or there is severe endometriosis, so all such couples are actually advised to go for a cycle of IVF and ICSI instead of going for IUI cycle. ICSI, if I explain, ICSI is basically a technique where we are deliberately taking one egg and we are injecting it with one sperm. We are selecting that sperm, we are looking under the microscope and selecting which one is the best looking sperm, or which is looking normal, which is having normal morphology, which is moving nicely, progressive motility is there. Then sorry, there was some missing. Yeah. So in the this maize where the semen parameters are a bit more deranged, then we have to go for ICSI. There we choose good sperms and we inject them in the egg. So we take one egg, we take one sperm, we inject it. That procedure is called ICSI. Nowadays we have many more advancements also besides it. Like PIXI is there, MAX is there, which helps us in selecting very good quality sperms out of those all which are there, which are not very good. So all these techniques, they help in selecting the best sperm and having a very good A grade embryo, so that if we have a day 5 blastocyst which is formed, so the success rate of cycle will definitely increase. So if we look at various guidelines which have been provided by the Western associations, like American associations or the Western world, all of them are based on Western data. All of them are according to their criteria, what they are looking for. So they have as such not recommended IUI for the couples of unexplained infertility or mild or moderate endometriosis, because obviously success rate is better in IVF cycle. But if we look at our Indian scenario, where neither of the procedures are being covered in IVF, neither the IVF nor IUI, neither of the procedures are being covered in health insurance, then in such a scenario, it is logical for our population, for our couples who are facing problem in conceiving, to go for IUI first and then go for IVF in case 2 or 3 maximum cycles of IUI are not giving good results. So IVF is specifically meant for those people in Indian setup in whom tubes are blocked or severe endometriosis is there, or if the number of eggs that is assessed by the AMH levels, that is low, then in such cases I would suggest them to not to waste any time, and they should plan a IVF cycle in a very near future. But that is why we should not directly follow the guidelines which are given by the Western countries, because whatever they are recommending is based on their data, their setup, what are the facilities they have. So in our scenario, as we have already discussed, IUI is really a very good option Though there are so many IVF centers nowadays, every market has 2 or 3 IVF centers nowadays. But I would again say that if your tubes are open and there is no any major this thing, severe endometriosis or very low AMH, if all these things are not there, then IUI is definitely a solution or one option for you, because it is much cheaper. If we compare IUI with IVF, the charges or the cost involved is 1/10 in IUI cycle, while IVF cycle, if you are saying it is in lakhs, the costing, it is 10 times the costing involved in one cycle of IUI. So if we are looking at an Indian setup, IUI is definitely one very good option. And considering the success rate, we can see through the success rate.
This meeting is being recorded.
So if we look at the success rate, it has been proven that the success rate of one cycle of IUI is not that good. But if we look at cumulative success rate of 2 or 3 cycles, then it is really good. And if we look at the benefit associated with the financials involved and the invasiveness and the number of injections and the number of visits to the clinic, all those things if we consider, then the success rate compared to all the efforts involved is definitely much higher if we compare it to the IVF. So that is why there is this option of IVF which we are providing, and it is actually good. What we have learned till now is that there is no use of going for a natural cycle IUI for a couple who is having some other problem other than having vaginismus or that thing, that they are not able to consummate their marriage. For those couples, natural IUI is meant just for those. And for rest of the people in whom tubes are open, in which the ovarian reserve is good, number of eggs are good over there, and in whom maybe mild endometriosis or mild whatever is there, they should definitely go for IUI. And if 2 or 3 cycles of IUI fail, then they can proceed for the IVF cycle. But IUI is definitely an option considering the Indian scenario. If we look at the research and the recommendations of the Western societies, then they are saying that no, the IUI cycles are not providing good results, so don't go for that. It's not meant for us. It's meant just for them, because they are being provided, they are being covered under the national health insurance. They are being taken. Everything has been being taken care of by the government. So they are deciding just by 1 or 2 factors. But if we have to look at the scenario where we are sitting in India, where no infertility treatment is being covered under any insurance, for us IUI is definitely an option. If we look at the procedure or the way the benefits, the way the procedure of IUI, if we compare the IUI procedure, it involves maybe maximum injections for 5 days if we are giving superovulation and we are doing a controlled ovarian stimulation. So we are giving injections for 5 days and maximum, and then the patient has to come to the clinic for IUI or follicular monitoring. It is a non-invasive thing completely, and once the eggs are ready, as is visible in the ultrasound, it usually takes maybe 10 days or 10 to 12 days after the starting of the periods. So once the eggs are ready, we give a trigger shot. These injections, they help in release of the eggs, and once this is done, we call the couple to the clinic. We do the IUI procedure. The procedure itself takes hardly 1 hour maximum, and it doesn't involve any hospital admission, any OT visit, or what we say, if patient is not very comfortable going to a OT or undergoing any procedure, nothing major is there. I would say no pain at all. It is completely a painless procedure, and there are no stitches, obviously, nothing, no scar marks, nothing is there. So IUI is completely, we can say, a painless kind of a procedure which can be done in a clinic setting. You don't need to get admitted in a hospital, and this can definitely boost up the chances of getting pregnant in that cycle. And once IUI is done, you are no, there's no need of bed rest. You can just follow your routine from the next day itself. So these are the things which are there, and which make IUI a really beneficial procedure as compared to IVF. If we compare it to the IVF, the number of injections which are involved in IVF are really, maybe they are around 8 to 10 days, sometimes 12 days also. And the total number of injections in a day are also varies from 1 to 2 to 3 also sometimes. Once the eggs are ready in IVF, we call you, you get admitted, you have to be in the hospital for a daycare procedure. You get admitted, the anesthesia is given, you have to be in the OT for half an hour maybe, though there is no pain during the procedure, but yeah, anyway, it is an invasive procedure. So if we talk about the advantages of IUI, it is relatively simple process, very simple as compared to IVF. It is very low cost also. As I already told you, IUI cycle costs 1/10 of the cost which is involved in the IVF cycle. And there is hardly any risk of ovarian hyperstimulation syndrome, which is definitely there with IVF cycle. So IUI has a bit higher, obviously patient acceptability is more, compliance is more in IUI. So IUI definitely has a very important role in our scenario, considering the setup in India. Though the guidelines which have been given, the Western guidelines have been there, which have said that IVF is more advisable as compared to IUI, but those guidelines are not meant for us. Those guidelines are for the Western countries where both the procedures are covered under national health insurance. So the costing doesn't matter at all, though the invasiveness it matters, but success rate, obviously if we just compare it with that, it is really very good in IVF cycles nowadays. Even we are also having very good results after IVF. So we can say again there is a new this thing in the IUI. We can say there is it has become more efficient and more beneficial for the patients, and we can say it is if we do IUI using gonadotropins by superovulation, then the success rate is really definitely much better as compared to the natural cycle IUI. Whatever option is used, there needs to be a strict cancellation policy we are definitely using to minimize multiple births. I really want to stress upon this. Multiple births is definitely a side effect, we can say, of any procedure, of any fertility procedure which we are undergoing, because whatsoever we do, IUI or IVF, the chances of having twins or triplets is definitely much higher as compared to the natural pregnancy. And till the time it is twin, it's not a major problem. But if it's triplets or if it's quadruplets, then definitely it becomes very high risk pregnancy. It becomes very risky for the mother, for the babies also. There are chances of prematurity. There are chances of preterm births. So there are many risks involved with multiple births. So definitely, whenever we are doing any procedure like IUI or IVF, we are taking utmost care to avoid any such possibility. And if we look at the various IUI procedures or the ways semen is prepared, there are many methods, but majority of them are giving the same results, one or the other. Though yeah, the count of the sperm, it definitely matters, and the mode of insemination also matters. Earlier we used to put in 0.5 ml of sperm suspension, but we have seen that if we are putting 1 ml of the semen concentrate which is being formed after sperm wash or centrifugation, then the success rate is much better. If we look at the Cochrane review, there has been a study which has shown that synchronized approach for intrauterine insemination in subfertile couples. So they did this thing to evaluate the effectiveness of different synchronization, natural and stimulated cycles in subfertile couples. So they found out that whatever injections we are using, there was no much difference in the live birth rate. What we were doing, we were giving HCG injections or the, but when they compared it with a natural cycle, they found out that the success rate is much higher if we are using gonadotropins for stimulation, or we are using clomiphene or letrozole, because it definitely increases the probability of the pregnancy. And if we look at various studies, here the pregnancy rate was found to be higher in the stimulated groups where multiple combinations were used, or different protocols are available for both the IUI, for IVF. We have fixed protocols which we are using, which are meant for that particular kind of a patient. So all these things in subfertile couples or the patients who have been really trying to have pregnancy and not able to conceive, all these things, they really help in having a very good result in the very first cycle, whatever it is, IUI or IVF, because it varies with the couple situation. What is the scenario at present? We need to make an accurate diagnosis. It should be made at the correct time. Delay in the diagnosis can lead to loss of that window of opportunity which we have. In case there are women who are coming to us at the age of 40, that now they want to go for IVF cycle. So I really want to tell them that the success rate of IVF or IUI or whatever procedure you are going for, it really declines a lot if your age has advanced from 35 to 40. So whatever decision you have to take, try to take it at around 35 or maybe 36. Don't delay it till 40. It becomes really difficult for us to try to get good quality eggs at that age, even after having a very high dose of gonadotropins or whatever injections we give. It is really difficult. So if we look at the IUI success rate or IVF success rate, all of them, they depends upon the multiple factors and the age of the women and semen parameters. These are really very important, because nowadays, due to lifestyle changes, we may say, or maybe the habits or smoking or alcohol, whatever it is there, all these things, they have definitely deteriorated the quality of the gametes that we are getting nowadays. The quality of the eggs is also not that good, which we used to have earlier. The quality of the semen is also not that good. Even in younger women in around 30s, there is some lifestyle changes or whatever stress is there. The quality has deteriorated a lot. So if the eggs are of not that good quality, then that will definitely hamper the success rate of an IVF cycle, because we will not be able to get good quality embryos. We have a very good result of IVF cycle, but only if the embryos which are being formed on day 5, I say, blastocyst, are of A grade or maybe AB grade. But if these are like B grade, C grade, then the success rate will definitely not going to be that good. So a person has to keep it in mind that whatever procedure they want to go ahead with, they have to take a decision quite early. Don't wait till your age of 40 or so. Nowadays, so girls are coming for oocyte freezing also. That thing has really helped in making them also free. They know that they have a backup. So oocyte freezing also becoming popular nowadays, and all those things can be used in IVF later on. Though oocyte freezing is not meant for IUI per se, but yeah, all these we have nowadays these techniques which are there, which help in conceiving later on if there is some problem in natural conception. And similarly, if we compare the IVF or IUI, if we look at women's perspectives on ovulation induction with or without IUI, as a normal person who is having a normal ovulation, so everybody has their own different their own, they're saying that they, no, I don't want to go for IVF. Somebody else says, no, I don't want to go for IUI. You need to decide it. You need to decide it earlier. And in many studies, it has been found that they were not very willing to go for any procedure to start with, but you should keep it in mind that whatever procedure you are going with, IUI or IVF or a natural pregnancy, everything, success rate for any of these things will deteriorate if the age is advancing. Nowadays, and though there is quite awareness among young girls, many girls are coming in their late 20s or early 30s for egg freezing. It is really helping in keeping a backup for such couples. So if we look at that IUI is better or IVF is better, I would say both are meant for different couples. Both are meant for different causes of infertility, and IUI is definitely helpful in our scenario, in our setup, where infertility treatment is not covered under any insurance. So IUI definitely is an important option, and it really helps in giving you a chance of pregnancy at much lower cost, which is less invasive also. So if you have, as we already discussed, if you have patent tubes, if your tubes are not blocked, then you can definitely opt for one cycle of IUI. No matter, I don't want to comment upon the success rate, but if you compare IUI and IVF, the cost and the invasiveness is definitely much higher in IVF as compared to IUI. And success rate, definitely is higher with IVF, but IUI, if you look at 2 to 3 cumulative cycles, then the success rate of those 3 cumulative cycles will be higher or maybe equivalent to one cycle of IVF. So you can definitely go for this thing, and IUI is done at all the clinics. You don't need to go for a major fertility center for IUI. You can come to the clinic. It is done. It doesn't need an OT setup. You don't need to get admitted. You don't need a bed rest after IUI. So there are so many benefits of IUI in case it suits you, in case the tubes are patent and there is no other contraindication for IUI. So all these things, these are really helpful. And if we say in our scenario, we can definitely consider stimulated IUI as a first line option in cases of unexplained fertility, and it has proven, it has really given us many good results in the past also. So the couples where infertility is unexplained, the super ovulation we call it as, or stimulated IUI, it is really beneficial. If we look at IUI for mild male factor subfertility, then also it is also good. It has given good results for where the semen parameters are just mildly deranged, not a major problem. If the counts are more than 10 million, then we can definitely plan a cycle of IUI. And obviously the chances of multiple pregnancy is definitely there. With IUI also, the chances of twins and triplets are more. We should keep it in mind, and we always take it. Though we have the this thing of fetal reduction, we can go for a fetal reduction later on. But to start with, we always try that. So it should be a singleton pregnancy or maximum twins, because if triplets or quadruplets are there, then it really definitely it becomes a very high risk for both the mother and the baby. And nowadays we have so many this thing for ovarian stimulation. We have clomiphene, letrozole or gonadotropins, injections are there, medicines are there, which help in making more than one egg in one cycle, and we can plan IUI in that cycle. It will definitely improve the probability or increase the probability of pregnancy. Without going for IVF, you can plan IUI cycle maybe 1 or 2 cycles before that, and it can give you very good results. It has given us very good results in the past. So IUI is also an option, and you should be aware of it, and we should keep it in mind. Yes, we can go for IUI in considering our Indian scenario. And though IVF is the last resort and it is really a very good resort nowadays, we are having very good results because of the improved techniques in the embryology, in the protocols, and as the chances of OHS is also decreased. So this way, I think we can end this session of comparing IUI and IVF. And if you have any queries, you can leave in the comment section or we can discuss it anytime, no problem.